Namaste. Let us differentiate between Chalazion and Stye. Let us start with a clinical presentation. The patient of Chalazion will present to you with a painless lid lump, which has progressed slowly over weeks to months, whereas a patient of Stye will present with acute inflammation and pain. In Stye, there is also tenderness and redness present. Chalazion is the most common cause of painless lid lump. Let's see the definitions now. Chalazion is a chronic lipogranulomatous inflammation which occurs due to blocked meibomian gland. Here, the main cause is blockage of meibomian gland secretion. So definition is chronic lipogranulomatous inflammation and the cause is blockage of meibomian gland. Whereas when we look at Stye, it is an acute suppurative inflammation of the eyelid and the associated glands. They are zeus and mole. The cause is Staphylococcus aureus. When we look at the onset, through the history we have seen that Chalazion has a chronic onset and a gradual progression, which progresses from weeks to months, whereas in Stye, the onset is acute because it is acute suppurative infection and it is rapid. When we look at the pain feature, as discussed, this is painless and Stye has pain. Tenderness and redness are also present in Stye, whereas in Chalazion they were absent. In Chalazion, the swelling is a firm rounded nodule, whereas in Stye, it is localized swelling, which may point like a small abscess. Now, it is important that here meibomian gland is affected, and meibomian gland is slightly away from the lid margin. So the position is slightly away from the lid margin. Whereas in Stye, zeus and mole are affected. And these glands are present towards the lid margin. So this swelling is present towards the lid margin. It's even better to say at the lid margin. When we look at the pus point, the pus point is absent in Chalazion, but it is present in Stye. Because Stye has two stages. The first stage is stage of cellulitis, and the second stage is stage of abscess. So pus point is seen in the stage of abscess. When we look at the course, Chalazion persists for weeks to months. It has a chronic course. We said that. So weeks to months. Whereas when we look at the Stye, it resolves early, in days to 1 to 2 weeks. Looking at the treatment, some part is common in both Chalazion and Stye. That is hot fomentation, lid hygiene, and analgesics. So these things will be common in both. Whereas in Chalazion, incision and curettage is an important thing, and also steroid injections we can get. Whereas in Stye, we can do topical or systemic antibiotics and also drainage of the abscess if the abscess is present and it is large. You can do great if you just remember that Chalazion has a chronic course, it is painless and it is a granulomatous condition, whereas Stye is acute painful infective condition. So that's all. Hope I cleared all your doubts. Thank you.